So tell me a little bit about your skin.
So I do get like some dry splotches, like, you know, in this area around the nose. You'll probably notice it already. Um, but it does get like fairly dry, especially around this time of year. Um, so that's really what's going on.
Hey Esties, so today I want to show you all how to perform a skin analysis. The first thing I did, I went in with the Dermalogica Pre-Cleanse with dry hands onto her dry skin. We don't usually use water when we are first applying and working in any oil pre-cleanse, mainly because we want that oil to attract other oils, dirt, and debris that's found in the skin. I really love this pre-cleanse. I like this Dermalogica pre-cleanse mainly because it has a lot of plant-based botanicals in it. It has some apricot oil in there. It has lavender oil in there, and it also has sunflower oil in there. And they all help balance out the skin. They help reduce, like, and purify any bacteria or any debris on the skin. And it also helps repair the skin's barrier. It thoroughly cleanses the skin without stripping the skin. And that's one of the main reasons why a lot of people use oil cleansers first and then they go in with a second cleanse. Now, I am about to add some water to this pre-cleanse, and this is why, another reason why this is my favorite pre-cleanser. When you add water to it, it emulsifies. So look at how it's turning white when I added water to this product. A lot of pre-cleansers leave like an oily residue on the skin, and most estheticians do not like that because when they go to touch the skin to do the skin analysis, they can kind of, in a sense, give a false analysis because there's still product left on the skin. So it's hard to tell whether the person's skin is oily because of the product or oily because their skin is just producing an excessive amount of oil. So I love this pre-cleanse because it emulsifies. Once it mixes with the water, you wipe it off the skin and you don't feel any oil residue at all. But little disclaimer, so I am actually launching new products this month. And so I have a pre-cleanse that does the exact same thing. And I'm not going to lie to you guys, I think it's a little bit better than this Dermalogica pre-cleanse. This is an effective oil cleanser that's going to pull out any oil, pull out any gunk and debris. But when you mix it with water, it literally takes the oil right off of the skin, and it effectively cleanses the skin. So it's not going to strip the barrier. It's not going to, leave the skin oily and gunky, because most people don't like oily cleansers because they feel like it does not effectively cleanse the skin. So if you want to see a little bit more information about that product that I manufactured, click on the link below in the description. That product is called the Balm Cleanser, and you'll be able to see what the cleanser is made out of and who it's beneficial for and how to use it. So make sure you click on that link in my website if you want to try the Balm Cleanser. And when I say the balm, I mean it is the balm. It's of course a cleansing balm, but it's actually literally the balm. It's better than this cleanser, and I love this cleanser. So anyway, back to the video. I am taking off the pre-cleanse with sponges. After I remove the pre-cleanser, I'm going to go in with a method using visualization and then something we call palpation, where you use your bare hands to touch your client's skin and determine their skin type, and also figure out if you see any abnormalities like any congestion, pimples, pustules, other name for pimples, papules, which are like little bumps of inflammation, or sebaceous filaments, right? Like clogged follicles with oil. You may even notice maybe some texture or sensitivities. You usually detect this by touching the client's skin. You can even do this method that I like to do. I like to rub my finger across the client's skin and then rub my fingers back and forth to see if I feel an excessive amount of oil or if I feel a normal amount of oil. And that's what you see me doing here. Listen to my students' interaction with this client's skin.
Her face feels oily and it expands.
But so when you say expand, exactly what do you mean?
It's not stiff.
Not stiff, right?
Yeah. What's the correct word for that? It's in the book. It has
Her elasticity.
Yes. The forehead is a little dry, it's a little bit, but around the cheek area and under the chin is nice and soft.
Okay.
So I would say hydrate the forehead. Hydration cream.
Okay. What about the bridge of her nose? What do you feel and see on the bridge of her nose?
Combing them.
Okay.
Yeah, it's a few of them. She can use a little bit of extraction right there in that area.
Okay. What does it feel like?
Little bumpy.
Okay. A little textured.
Yeah, a little textured.
Okay. All right. So I would say her skin is normal to dry. Her elasticity is great.
Yeah.
Right. And just a little bit of texture on her nose and her forehead, on her chin a little bit.
After carefully analyzing your client's skin, then you can pick the proper products to normalize some of the symptoms that you see. That's how you effectively perform a skin analysis to get you to your treatment goal and anything that you want to do after you analyze the skin and see what's going on with the skin. I really hope you all enjoyed this content. I hope that it was very helpful to you. I know skin analysis can be very hard, but you all are a part of the family. If you ever have any questions or concerns, do not hesitate to comment and we will help you as much as we can. Talk to you soon.